According to Stephen Hayes, who developed acceptance and commitment therapy, ACT helps us transform emotional pain, free ourselves from negative thinking and self-judgment, commit to what we care about, and live a life we value. Now that all sounds pretty good, so how does it work? The aim of ACT is to enable us to live a more meaningful life that reflects our values and what's important to us. And it does this by allowing us to move past whatever barriers we face as we travel along our path towards building the life we desire, without letting these obstacles block our way, send us on a detour, or force us to travel in the opposite direction, and put our lives on hold as we wait and hope for these barriers to remove themselves. Now, the barriers we're talking about aren't external factors. The obstacles that stand in our way come from our aversion to feeling bad. We're trying to avoid having negative, private, internal experiences. In other words, we don't want to have to deal with uncomfortable or unpleasant or distressing or painful feelings and emotions, thoughts and memories, and physical sensations. So first, we try to avoid these feelings and thoughts by trying to shut them out, suppress or ignore them, distract ourselves from them, or even drink or take drugs or try to eat our emotions away, and just try whatever we can so we don't have to experience these unpleasant feelings and thoughts. And this might work for a while in the short term, but eventually it fails because we can't control our internal experiences in these ways. And in the meantime, these things we were trying to suppress were growing behind the scenes the whole time and reemerge stronger than ever and even more difficult to bear. And once we figure out that we can't directly control how we feel with these methods, emotionally or physically, or control what thoughts pop into our heads, we try to control these things indirectly by controlling our environment and avoiding things that we fear could provoke these negative internal experiences that we're trying so hard to avoid. For example, let's say you have a crush on someone. Now, even if you think they might feel the same way about you, it's pretty common to avoid doing anything about it. Because as much as you'd like to spend time with this person and get to know them better, the thought of pursuing anything causes you anxiety. It can be tough to work up the courage to ask someone out. And if they turn you down, now you feel embarrassed and disappointed and sad, and you don't want to feel like that. And it's not just these negative emotions that we're trying to avoid, but the negative thoughts about ourselves they provoke. I'm such a loser. Why doesn't anyone want to go out with me? I'm never going to find anyone. I'm doomed to being alone. And the physical sensations that go along with anxiety. Feeling nauseous, or butterflies in our stomachs, or a tightness in our chests as we get nervous about approaching them. And so we decide to do nothing in order to protect ourselves from the possibility of having any of these negative experiences. And in a similar fashion, we might choose not to take a promotion at work because we want to avoid the stress and anxiety that goes along with a new position, and the thoughts that we won't be able to deal with it, or that we're not good enough in some kind of imposture. Or we avoid any number of things that are important to us because we'd rather miss out on them than risk feeling bad. So ACT is about helping us move forward towards a valued life by giving us the tools and skills we need to feel confident that we can manage these negative internal experiences well enough that we're willing to risk having them in pursuit of what's important to us. So why is it called acceptance and commitment therapy? ACT helps us respond to difficulties in our lives with mindful acceptance rather than avoidance, as we make a commitment to moving towards a life we value. Now, it's important to clarify what we mean by acceptance. It's a fact of life that we all experience pain, both physical and psychological, and there's nothing we can do to remove, avoid, or suppress all of the pain in our lives. And when we try to do this, we might alleviate some of the pain in the short term, but we end up creating even more pain for ourselves over the long run, because the more we try to avoid our unpleasant internal experiences, the stronger they tend to grow. And the more we avoid external situations to try to prevent ourselves from having these unpleasant internal experiences, the more our lives start to shrink and become limited and restricted, which tends to increase the level of anxiety we experience and can leave us feeling depressed. So the alternative to avoidance is acceptance. Now, the word acceptance has some different connotations. It can mean willing to take what's offered, but it can also mean tolerating or resigning ourselves to something that we don't like. Now, ACT uses the terms acceptance and willingness synonymously to emphasize that in ACT, acceptance is used in the sense of willingly taking what's offered, and not in the sense of tolerating or resigning ourselves to things that make us miserable. So acceptance and willingness are the opposite of avoidance and control. So if you're interested in learning more about acceptance and commitment therapy, you'll find an outline of all of my ACT videos in the pinned comment and description. And please hit the like button and make sure to subscribe to my channel so you don't miss any of these videos as they come out. And in the next couple of videos, we're going to look at acceptance in more detail and how we can learn to accept our physical and emotional feelings as well as our thoughts as we move towards a better life for ourselves.